Croeso, Prananda. Welcome and good afternoon, everybody. Delighted to welcome you all to this first board meeting of Digital Health and Care Wales, new strategic health authority being set up from today in Wales. I'm Bob Hudson. I've been appointed as the interim chair for the board, so it's my great pleasure to chair this first meeting and to welcome all colleagues along. I just want to say a few words by way of welcome and some notices in terms of how we'll run the meeting during the course of today, before moving into the rest of our agenda. It really is a very significant day for us today, I think, as the new SHA is created, building on the work of NWIS, the previous NHS Wales Informatics Service, and becoming the 12th member of the NHS family in terms of the statutory organisations responsible for delivering healthcare in Wales. Our remit is to support the wider system, enabling improvements in the quality of health and care, and how we take advantage of new technologies, delivering new services to patients and the public, making the work of our staff across the system easier, and how we exploit and use data to improve health and well-being for people in Wales. I think one point that I would make right at the outset is that this is not just a rebranding. This is the creation of a new organisation with new leadership in terms of colleagues who are around the table today, both independent members and executive members, with a system-wide responsibility in taking forward the digital agenda for the NHS and working with wider stakeholders across Wales. The new organisation has a wider remit. Certainly that's reflected in the title for the new organisation in terms of health and care, meaning that we will need to work more fully with partners across other organisations, other agencies, as well as recognising our wider role across Wales in terms of building digital capability and building the sort of digital ecosystem and supporting the economy in Wales, as well as just the NHS and social care. So it's a momentous day for us in many ways, and I think that the last 12 months, as the previous organisation, NWIS, has supported the NHS through the COVID pandemic, these last 12 months have really demonstrated how important digital technology is and shown really just what can be done. So today, as the first day, the first board meeting for the new organisation is really about building on that momentum. So it really is a great pleasure for me personally to be here chairing this first meeting to welcome our new board members here. Just in terms of the conduct of our business, clearly, in terms of the new board meeting in public, we are constrained, as everybody else is, by the restrictions that are still in place in relation to public gatherings. So it's not yet appropriate for us to meet as a public board with people in attendance at the public board meeting, and hence the broadcasting live of the meeting today. But that is something that we will continue to do, whatever the arrangements are down the road in terms of people coming back together again. This will be a part of the way that we connect to stakeholders and those people who use our services. And I would like to welcome any observers from the public, from other stakeholders who have joined us today to observe this first board meeting. Just a couple of things in terms of how the board itself will work today. Only those who are speaking will be on camera and will be brought in on camera when either presenting an item, or if a colleague is asking a question or making a comment after an item has been presented, then the camera will switch to those individuals. Forgive us, those of us who are on camera, probably myself mostly, more of the time, if occasionally I'm not looking at the camera because I'm looking down at my notes and reading my papers, but that just is something that we have to do. In terms of the timings this afternoon, the board meeting is scheduled to run from 1 through to 4 o'clock. We will be taking a short comfort break, probably about 2:30, depends on how we get through the agenda item. So those external to the meeting who are observing, just be aware of that. In terms of the actual agenda item, the only other thing I want to highlight before I just make a few other introductions is in terms of, we have a section on our agenda today. It's called the consent agenda at sections 2.1, 2.2, where, because of the volume of the material around those items and the purpose of those items, which is literally getting this board going today in terms of having agreed standing orders, standing financial instructions, and agreeing initial set of policies that will guide our work. We have had a process outside of the board meeting where board members have been able to offer any comment on those items. So when I get to that point on the agenda today, I am hoping to move through that fairly quickly, because we have already given people an opportunity to comment on those papers. What we will do is record any comments and publish any comments that we've had, and any questions, if they arise, will be picked up in the minutes of the meeting as well. But that's just to recognise that this is very much our first board meeting. We need to have those measures in place to enable us to conduct our business, and we're largely in those following standard policy and guidelines in relation to the conduct of NHS boards in Wales. If I can then just, by way of introduction, we were joined as a team just a few weeks ago by our Vice Chair and our independent members, public appointments made by the Minister, Vaughan Gethin. And we have a full complement now in terms of the board, in terms of our Vice Chair, Ruth Glazard, and 5 independent members, Grace Quantock, Rowan Gardner, Sian Doyle, Marion Wynne-Jones and David Selway. And I'm delighted to welcome them as members of the board and to their first meeting here today. I'm not going to get colleagues to introduce themselves at this moment, but for those outside of the meeting who are observing, if you want to know more about the board members, I would point you to our website, where details of colleagues' biographies are posted, and indeed as well the ministerial statement that was made just a week or so ago announcing the appointment of our board members. Helen Thomas, our interim chief executive, in her report later will introduce executive and other senior colleagues who are with us today as well. So I think that concludes the welcome and introductions that I wanted to make. So I will move on now to the formal parts of our agenda. Initially, it's taking apologies for absence, and unless I'm corrected, I don't believe we have any formal apologies from board members today. So that's item 1.2. Item 1.3 is just an opportunity if any board member needs to highlight any potential conflict of interest. That relates today to the agenda items that we have before us. We do, as a matter of course, as an organisation, have to develop and are in the process of developing a full register of members' interests, which will be a public document. But if I could just pause if there are any independent members who need to, or any other board member, I should say, who needs to declare any potential conflict of interest with any of the agenda items today. Okay, I'm not getting anything through to me to indicate that's the case, so I will assume, hopefully safely, that there are no conflicts of interest. That moves me on to part 2 of the agenda that I've already referred to, around the establishment of Digital Health and Care Wales, which is the consent agenda. And as I've indicated, we have a number of very weighty documents that have been prepared, and our board secretary, Chris Darling, and Director of Finance in particular, have been responsible with colleagues in Welsh Government for pulling those documents together. And I just need to formally make sure that we can approve those today, given the opportunity that colleagues have already had to comment on those and raise any particular questions. So first of all, item 2.1 is the ratification of our standing orders and our standing financial instructions. Can I take those for approval? And if nobody flags anything to me within the next sort of few moments, I will assume approval from board members for item 2.1. Okay, I'll take that as the item is supported. So we've approved and ratified the standing orders and standing financial instructions for the new organisation. The next item, 2.2, governs quite a long list of policies for adoption by the board. Again, this is essential to underpin our working initially. And these policies have a variety of, they come from a variety of different places. A number of them are standard All Wales policies that we are required to adopt. Many of them are policies that the previous host organisation, Velindre NHS Trust, has had in terms of governing the work of the prior organisation, NWIS, that we need now to roll over and adopt to continue functioning in the new organisation, and also areas where we have new policies that we will develop ourselves. What I should say is that all of this is subject to ongoing review as we make sure that the suite of policies that underpin our ways of working are adapted and bespoke to the new organisation where that's possible. So again, can I just seek affirmation from colleagues that you are content for me to press ahead with the approval of those essential policies for adoption? And again, I'll pause to give anybody an opportunity for question or comment before moving us on. Okay, thank you. I will assume, therefore, that we are approving those essential policies for adoption. That moves me on to item 3, or part 3 of our agenda, and the first 2 items there, report from myself, brief report from myself, and then I'll hand over to Helen Thomas, our interim chief executive, for her report. From my point of view, there's not a huge amount to talk through at this stage, given that this is our very first board meeting. But what I do need to highlight, in addition to the independent members and vice chair that I've already introduced, is a couple of other points in relation to the appointment of members to the board. The first thing is really just to note around my personal position, in that I was appointed to the role of interim chair of Digital Health and Care Wales in November 2020 to provide leadership to the emerging board running through the establishment of Digital Health and Care Wales and into this sort of first period. So that's a ministerial appointment that was made for a period up until the end of October of this year at the latest. The process for appointing the substantive permanent chair to the organisation will commence as soon as is practically possible after the forthcoming Senedd elections. You will appreciate that we are now in the pre-election period, and therefore public appointments don't move forward at this stage. But once we are beyond that, it is the intention of Welsh Government to move forward with the process, the full public appointments process, in terms of the permanent chair to the new board. As I've said already, the vice chair and 5 independent members have been appointed by the DHCW board. I would also add that Helen Thomas, who will speak in a moment, was appointed as our interim chief executive by ministerial appointment in January 2021. Again, this is a time-limited appointment through to the end, to the beginning of September, whilst the recruitment process runs for the permanent chief executive post. That process is live as we speak, and at the moment we are expecting that the interviews for the permanent chief executive post will take place in early May. In terms of the conduct of the board, I think I've referred to this already in relation to the fact that we are constrained by current restrictions. What I would say is that as a new board, we are absolutely committed to operating in an open and transparent way. Our papers are already published for the public to see, and we will be speaking later on the agenda about the conduct of future board meetings, because we want to develop this approach in terms of, as I say, openness and transparency with the board, and develop our approach to live streaming board meetings, and hopefully beginning to be able to move forward to make them more participative when that's appropriate. And I should also highlight that we will, as we develop our Welsh language policy, also be looking to enable our board meetings to be simultaneously translated, so we can operate in a bilingual environment as we develop our Welsh language scheme. The final item I just wanted to make note of today was in relation to our membership of the Nhs Confederation. This will be new to most of our independent members, but we are now, as a new statutory body, formal members of the Nhs Confederation, alongside the other 11 bodies in Wales. And the Confederation provides a wide range of support services to its member bodies, represents our interests into government. It's part of a UK-wide, well, excluding Scotland, part of a UK-wide Nhs Confederation, so it connects us strongly with colleagues in the NHS in England in particular, and provides a wide range of support services, from supporting the networks of chairs, chief executives and other executive groups, briefing notes for board members and so on. So it's an important body that we are formally members of. And at the last management meeting of the Confederation, it was just to note that the meeting confirmed that the current Confederation chair is Professor Vivian Hartwood, who's the chair of Powys Teaching Local Health Board. Her tenure in office has been extended through to 2022. So I'd just like to note that, and my congratulations to Viv on behalf of this board. But there'll be more to talk about in relation to the Confederation within the board in due course. So that concludes all I want to say by way of my initial report to the board. So I'm going to hand over now to Helen Thomas, who will take us through her Chief Executive's report. Helen, over to you.
Thank you, Bob, and good afternoon, everyone. So just a short report for the first one as the interim chief exec of Digital Health and Care Wales, and actually the focus of the report is really about today, and the launch of the new organisation. So we're here. It's the 1st of April, and we are now live as a brand new organisation. And just to say that we at the last SHA programme board that took place just last week, actually, that we had no outstanding issues or risks, and everything was on track for today. And indeed, we've arrived at the launch today. So a tremendously exciting time for us as a new organisation, and a new board, actually, as we move forward. So we've had a number of events today. This morning we had the staff briefing, which I'm glad to say that the board members were able to join with our staff, and we had an address to the staff and to the board members from the Chief Executive of NHS Wales, Andrew Goodall. So yes, and the culmination of today's activities is this inaugural board meeting for DHCW. So really there are just a couple of things for me to kind of highlight this afternoon to you all, picking up on Bob's chair's report in terms of where we are with board appointments, in terms of executive appointments and board appointments. So as Bob said, I'm currently the interim chief executive as we work through the process for the substantive chief executive to take place in the coming months. We've been successful in appointing our executive medical director, Rydian Hurl, who is here with us around the table today, or the virtual table, and Claire Osmondson Little has been appointed as our executive director of finance. And we also have Chris Darling, who is our board secretary, who joined just over a month ago, I think, and it's been a very busy month for Chris in terms of getting the board set up and getting us to today. I'd also like to take the opportunity to introduce other members of the senior leadership team that are also here today. So that would be Michelle Sell, who's the Chief Operating Officer for DHCW, Cadwyn Lloyd-Jones, who is the Director of ICT, and Rachel Powell, who's the Deputy Director of Information, and we have another member of the senior leadership team who's not with us today, who's Gary Bullock, who's the Director of Application Development and Support. Moving forward, the remaining 2 executive positions will be worked through and appointed to once the substantive chief executive position has been filled. So that will be coming in the coming months. And the only other thing to highlight to the board today is that we submitted the draft annual plan in line with all other NHS organisations. We submitted that yesterday for DHCW, and the board members will have the opportunity to get into that in more detail at the first development session, which will happen later this month, with a view to bringing it to the May board for review and approval. And I think, Chair, that's all I needed to raise today.
Thank you, Helen. Really, I think with my item as well and the Chief Executive report, the board is just being asked to note the content of those reports today, unless there is anything that any colleague wants to raise at this moment before I move on to the next item, and anything that's come up through my report or through Helen's report. No? Okay, thank you. If not, I will move us on now to part 4 of the agenda, where we've got a number of items that we need to take, which are fundamental to the basic governance of the new organisation. I'm going to hand over to our board secretary, Chris Darling, initially, who will take us into the first item, 4.1, under this section of the agenda, which is around the board and committee structures. So, Chris, can I hand over to you?
Yes, thank you, Chair. Colleagues would have seen the agenda, the report in papers, so I will run through and pick out the key points. Digital Health and Care Wales has established a board and committee structure to reflect the requirements within our standing orders, and it's in the process of implementing this structure, with today's board meeting being a key milestone in that implementation. The board's main role is to add value to the organisation through the exercise of strong leadership and control, and the bullet points in section 2.1 expand on the role of the board. In terms of the board makeup, the membership of the Digital Health and Care Wales board shall be no more than 15 members, including a total of 7 independent members. And as the Chair mentioned earlier, those have all been appointed to. There can be a total of up to 5 executive directors, with choracy achieved through at least 6 board members, at least 2 of whom are executive directors and 4 who are independent members. In addition, up to 3 associate members may be appointed to the board, and the process of appointing the first associate member will start with the appointment of a trade union associate member. Associate members will attend board meetings on an ex officio basis, but will not have voting rights. The Digital Health and Care Wales board will appoint committees of the board to provide assurance and advice to the board in the exercise of its functions. And Digital Health and Care Wales has designed a committee structure, again, to cover the aspects set out within the standing orders. And these explicitly include audit, remuneration and terms of service, and oversight and scrutiny of quality, safety, information governance, data quality, security and risk. In addition to the committee structure, we may, as directed by Welsh ministers, must appoint advisory groups to the board to provide advice to the board. And initially, we will establish a local partnership forum as our first advisory group to the board. This local partnership forum must effectively represent the views and interests of the Digital Health and Care Wales workforce. Up to 2 additional advisory groups to the board may be established. And section 2.5 of the report sets out pictorially the board and committee governance structure. In the future, the board may establish additional committees to help conduct its business. So board members, I'd also ask that they note that membership of the board committees, including committee chairs, will need to be progressed and agreed by our chair over the coming weeks to ensure that we can establish that committee structure as quickly and effectively as possible. So today, Chair, I'm asking for the board to note the board and committee structure and the need to agree committee membership as a priority moving forward.
Thanks, Chris. For those colleagues who are connecting into the meeting from outside, you may notice a pause between one item ending and somebody else coming in. It's just while we wait for the mics and so on to go live. Chris, thank you for taking us through that. As you say, it's today it's really an item for noting. The committee structures, as you've set out, are those that we are required to have. I think the only point I would add, which is going back to the earlier discussion in relation to openness and transparency, is that there is also an expectation that our committees operate in that way, and this will be a really important part of the way that we work as an organisation moving forward. Before I move us on to the next item, again, I will just pause to see if there's any question or comment that any board members want to raise at this point about that item. Okay, so we'll note the board and committee structure. I'll now take us back to Chris for item 4.2, because we are in the process of developing our annual programme of business. And Chris, again, can you just take the board through the paper? Again, this one for the board to note today. So Chris, back to you.
Yes, no problem. So the Digital Health and Care Wales Board should, on an annual basis, receive an annual cycle of board business, which identifies the reports which will be regularly and routinely presented to the board for consideration. The cycle of business presented today, set out as item 4.2a in the papers, is a draft cycle of business, which we will continue to work on and refine to come to the board meeting in May for approval. In future years, it's intended that the annual cycle of business will be presented to the board before the start of the financial year. But as we're starting on the 1st of April today, we've brought the draft as we have it. Board members should note the cycle of business covers the period from the 1st of April 2021 to the 31st of May 2022. And is arranged under the headings of preliminary matters, governance, risk, performance and assurance, workforce and organisational development, planning, finance and board effectiveness. In addition to the cycle of business, board members are also asked to note item 4.2b in the papers, and this is a summary of key board dates over the next calendar year. This includes formal board meetings which have now been set for the year, and board development sessions which will take place on a bi-monthly basis. The dates for those are still to be confirmed, but will take place every other month. The cycle of business and key meeting dates and frequency should hopefully give board members a feel for the future rhythm of our board meetings. And I'm asking, Chair, for those in attendance to note the cycle of business and the summary of key dates.
Okay, thank you, Chris, and thank you for putting this together in terms of, as you say, the first draft of our cycle of business. Hopefully, it gives board members and other people who have joined our meeting today a sense of the rhythm of the first year for Digital Health and Care Wales. And you can see from those key dates that we have our formal board meetings such as this on a bi-monthly basis, with our board development sessions in between, very much following the pattern that the other health boards and trusts in Wales currently follow. So again, can I, unless there is any comment or question from any board members in relation to these, we will just note that draft annual programme of business, and that will come back to the board on a periodic basis as it is further developed. Okay. If I can move us on then to item 4.3 on the agenda, which I think is, in some senses, is a more substantive agenda item than the things that we've had to go through in terms of establishing our business, but a very important one in relation to the financial allocation for 21-22 for the new organisation, and this does require the board to actively agree to a number of things during the course of this. So I'm going to hand over to Claire Osmondson-Little, our Executive Director of Finance, to take us through the report. And Claire, at the end, I'll make sure that we come back to ensure that we've got agreement to the recommendations within the paper, or that we agree some alternative course of action if board members should so require us to do so. So Claire, can I hand over to you to take us into your agenda item, please?
Thank you, Chair. This presentation complements the board paper and outlines the funding for DHCW from both a capital and a revenue perspective. If we can go to the next slide. It shows how we've internally applied the funds within the organisation, and it includes our assumptions in relation to the savings plan and any current risks, none of which are for escalation at this point, just for note. Following this presentation, the board is requested to approve the approach that we've taken. Go to the next slide, please. The objective is for DHCW to have sufficient funding to deliver the objectives outlined in its annual plan, which we know we completed yesterday, and to deliver this with a break-even position at the end of the financial year. The annual plan has been drawn up together with its resource allocation and funding requirements. These funding sources are many, and I will share this with you shortly, but they're split into two. The short-term funding requirements, known as revenue, and then the longer-term investment capital funding. The funding is one-off, can be one-off, which is non-recurrent, or part of the annual funding allocation, which is recurrent. These funds will be allocated to resources requirements laid out in our annual plan, and they are really split into two: workforce, which is roundabout pay, and then contractual, which is our non-pay. The plan and the actuals are then tracked and reported via the board as part of the monthly monitoring returns, and these are also submitted to Welsh Government. I'm now going to talk you through those key steps. Go to the next slide, please. This slide shows you our funding streams. The total funding for DHCW for next year for revenue is 127.5 million. However, there is baseline funding and additional non-recurrent funding. The important line is the top one, the Welsh Government core recurrent allocation, which, as you can see, is 42.3 million. A further 14.8 million is ring-fenced GP primary care digital funding. In addition, there are some small initiatives which attract another £300,000. We then have our depreciation allocation, which is just shy of 9 million at 8.8. And finally, we have the SLA with our health boards and trusts. that for next year is totaling 28.5 million. In addition to this, we will have what's known as non-recurrent funding, which is primarily related to the COVID response, and also an allocation from the Digital Priorities Investment Funds, known as DPIF, which for next year is estimated at 32.8 million. Also, from a capital perspective, the Digital Health and Care Wales has been allocated a 3 million discretionary capital for next year. But it does, however, have additional capital activities that it's involved with in relation to COVID, but also in relation to the DPIF funding. This totals 12.7 million, making our total capital plans for next year 15.7 million. If we move on to the next slide, please. From funding, we then go to our allocations. Our annual plan priorities are set out in our annual plan. The resource allocations are then translated, and this is then balanced and put into our financial plan. The overall allocation approach and plan has been agreed and taken through the local executive team. Following this, each directorate lead validates their allocation, and we then delegate this through to budget holders, who will then have to agree and sign the budget holder allocation letters, and this will be happening in the forthcoming fortnight. We move to the next slide, please. In establishing our budget baselines, there are a number of planning assumptions that we've adhered to, and these are somewhat directed by Welsh Government. Most of those relate to inflationary assumptions around pay and non-pay, and as you can see, within the plan we've assumed 2%. Also to note, there are programmes and ring-fence allocations that have stipulations against them, and they usually are related to phasing or pre-agreed cost related to contracts. These again have been built into our baseline budget assumptions. If you'd like to move on to the next slide. DHCW budgets in most cases have been allocated an efficiency factor or savings plan. We've identified areas of opportunity, and throughout the year we will monitor the progress against those savings plans through the board. Move on to the next slide, please. This slide is quite detailed, but it shows you the more detailed allocation that we have allocated to directorates within within DHCW. This is showing both the revenue allocations. It shows the savings targets that we've applied, but equally it shows the capital allocations for each directorate. And therefore, this is what we are planning to now delegate down to budget holders within each of those directorates through the budgeting process. I'd like to move on to the next slide. In terms of discretionary capital, as I've already mentioned, we have a £3 million allocation for 21-22. This will be predominantly allocated within the informatics, communication and technology, our ICT department. And this will focus primarily on the essential replacement of our infrastructure. I'd like to move on to the next slide. Through doing the plan, we've also identified areas of risk. These have included things such as in-year cost pressures, which we would have to mitigate. The key other aspects of note are the recruitment pace, because we have assumed a number of recruitments in line with vacancies within the organisation. We are planning, obviously, to deliver the plan within the current resource definition. We have also had to make some assumptions around external factors such as the COVID impact and potential exceptional infrastructure implications. We've also got a plan in terms of our savings, and we're not expecting any changes to the SLA income, but again, that is an area of risk. And finally, the last slide. So what I've attempted to do with this presentation is highlight the funding streams and how we've approached the allocations within our directorates to deliver our annual plan. It's based on the Welsh Government planning assumption and includes an efficiency target. Whilst it's a plan, there are some areas of risk identified, but we've also highlighted areas of mitigation. This is a sound financial allocation for the new organisation, and the allocations will enable us to deliver our priorities for the forthcoming year. I would now ask the board for their support and approval of the approach and allocations proposed, and I'm happy to take any questions. Thank you, Chair.
Thank you, Claire, for taking us through your paper and that very clear presentation, I think, sort of setting out the steps that we need to take. Before we come to the sort of the decision on the different items that you've highlighted in the paper, I would just open up to board members if there are any questions or points of clarification that you want to raise on Claire's paper. While you were thinking of that, just a couple of comments that I would make. I think one was to reflect the fact that there is good news in this report, Claire, in the sense of the uplift to the baseline funding for Digital Health and Care Wales compared to the previous organisation, NWIS, which is very positive, and the acknowledgement that there is developmental money in here as well, in terms of being able to take forward some of our plans. Obviously, there are some risks in there which you have highlighted, which is great. And I think what I would say is to all board members is, this report reflects where we are at a moment in time within literally day one of the new organisation, but clearly a lot of work has been going on moving up to this point in terms of the development of the plan for this year. That has to have a financial plan that we can accept at this point to enable the organisation to work effectively. But none of this is set in sort of tablets of stone for the long run. The board will have an opportunity to come back and look at elements of the financial plan in due course, and it will evolve as our plan evolves and so on over the year ahead. I can see a couple of board members, I think, that want to come in with questions. So I think Sean Doyle. So Sean, we've missed the start of your question. Just you need to pause while it goes live. I think you're live now.
Okay. Thank you, Chair, and thank you, Claire, for the very sort of sound methodology, I think, from a budget perspective. I think as my question relates to Bob's comment, really, I think as board we need to just understand the current plan, the programmes that's been committed to, the objectives and the returns, and I think we as a board it'd be good to understand that as we continue to flex through the budget over the next 12 months, because clearly there will be great news that there's an uplift, but there are some funding that we need just to keep the lights on, and as we get familiar with the programmes, understanding what's the objectives, but also what we might want to stop doing in order for us to focus on the key priorities. So I think, the methodology feels absolutely fine for now, but I think there's a bit of work for us as a board to do to get familiar with that priorities.
Thank you, Sean. Claire, do you want to come back on that at all?
Yep.
I think you're live. Yeah.
Thank you. Yes, I think in some ways you're seeing one side without seeing the full detailed annual plan, which we will go through in the forthcoming month and review in May. And I think when you put those two pieces together, you will have a real insight into how the realities of that allocation with the activities and the deliverables that link with that. Yeah, thank you, Chair.
Okay, thank you, Claire, and thank you, Sean. Marion, you wanted to come in with a question as well.
Diolch Cadeirydd a diolch I Claire am I adroddiad cynhwysfawr. Thank you, Chair, and thank you, Claire, for your comprehensive presentation, which sets out the scene and the challenges ahead for us. Notwithstanding the comments that I've just heard, I guess my overriding concern would be that when you look at industry best practice in terms of what would be regarded as an ideal level of investment in digital infrastructure, We know that the NHS sector in Wales is some way from that. And I guess, given our level of ambition and our keenness as a board to see transformation, to see the organisational benefits and the systems benefits as well falling through, how concerned would you be about our ability, and perhaps this is a wider question that Helen might want to come back to at a later stage, how concerned are we, or should we be, that the funding envelope as it stands currently will be challenging to enable us to deliver all those things?
Thank you, Marion. Claire? Claire?
Yep, thank you. Thank you, Marion. You're right. The funding around digital, I think the sort of benchmark is 4% in terms of the level that you require. Two things from me. One is we have based our deliverables for the next 12 months on this financial envelope. And as the chair has already mentioned, Welsh Government have put in a 10 million uplift into the organisation to support the initial plans that it has in its deliverables. And equally, there is that digital investment fund that the Welsh Government have inflated, which will give us some additional leverage in the transformational space. So for this year and for our deliverables this year, I'm more than confident that we've got enough fuel in the tank to get us to our destination. I think it is an interesting question as to what is a sustainable level of digital funding for the ambition that we might develop as a team in the forthcoming months. And I think that's really a role for us as a collective to set that ambition and set that challenge probably back to Welsh Government to ensure that tank remains full to get us where we ultimately want to go to. So thank you, Marion. I hope that response is sufficient. Thanks, Chair.
Thank you. Thank you, Claire. And Marion, I think I would just add, because we can't, it's not for us today to speculate idly about the next 10 years in terms of resources. I think I'm not speaking out of turn when I would say that I think we would all recognise that in terms of getting to sort of industry benchmarks and so on, you probably need to think in terms of a doubling of expenditure in the NHS on digital, and that's not with digital, just with Digital Health and Care Wales. That's across the whole system, because the significant amounts of the expenditure are obviously undertaken by health boards and by trusts directly. But that is part of the strategic conversation that I think we as a board need to have with Welsh Government in future. And I bring it back all the time to this is not just about expenditure, it's about what do we do with it and what benefits do we get that flow from that. I think I was reflecting in the staff meeting this morning, a conversation I had yesterday with a colleague in local government in Powys who was talking to me about some of the benefits that they're seeing from the Welsh Community Information System flowing through from relatively modest investments in digital technology, the ability to share data, that were bringing real tangible benefit in terms of improved outcomes and better value, cost reduction by better managing and being able to deliver services to clients across the local authority in that particular case, from improved discharge from hospital, better approaches to look after children and so on and so forth. So I think one of the things which is incumbent upon us is to be able to not just talk about the money that we need, but what will we deliver with it? What will be the wider system benefits that flow from that? So the conversation is about investment, return on investment, rather than about what does digital cost us, just in that way. So I think interesting conversations to come. Any other questions or comments from other board members in relation to Claire's paper? Okay, I'm not seeing anything there in my sidebar. So if I can just take us back then to the formal requirement today. So first and foremost, we are noting the current funding allocations, and they're quite complex, but as they've been set out very clearly in Claire's paper. And Claire's advice to us as our Executive Director of Finance is that we have a financial plan that should see us through in a balanced position during the course of this year, notwithstanding some of the risks that we understand are there. That the board is agreeing, I'm taking that we are agreeing the methodology that's been utilised to establish the 21-22 delegated budget. So that's essential for today to enable our teams to get on with what they need to do. That we're being asked to approve the approach to saving allocation and future actions, and that we are being asked to approve the initial, at least, high-level 21-22 delegated budgets, and at this stage to note the key risks that have been outlined. But that is something that we will return to during the course of the year, and clearly our audit committee will also look at during the course of the year. So that's the ask in terms of this agenda item this afternoon. Again, I'll just pause for a moment to see if anybody wants to flag any concern from that. No, okay, I'm not getting anything through. So I'll take it that they as set out in Claire's paper, that we have either noted, agreed, or approved as requested within the paper. So thank you for that. And Claire, thank you again for your work and the work of all your team in getting us to this point. And it feels good having that sort of clear plan set out for the year ahead. Okay, if I can move us then on to the next item under this section of the agenda, where I'm going to go back to our board secretary, Chris Darling, who's going to take us into a brief discussion about the future meeting arrangements for the board. And Chris, can I hand over to you, please?
Yeah, thank you, Chair. And this paper is one that you alluded to earlier and is very much in the context of us coming together as a statutory body within NHS Wales during the current COVID-19 restrictions and how we operate as such. So in line with our standing orders, the board and committees of Digital Health and Care Wales shall conduct as much of its formal business in public as possible. However, in light of the current guidance in relation to COVID-19 restrictions, the board and committee meetings at this stage will not currently be held in public. A decision made to ensure we're protecting the public, our staff and board members. That said, the Digital Health and Care Wales board has a responsibility to actively encourage the engagement and, where appropriate, the involvement of citizens and stakeholders in its work to demonstrate openness, transparency in the conduct of our business. And to ensure members of the public are able to observe board meetings, today's first Digital Health and Care Wales board meeting is being live streamed via MS Teams to allow citizens with internet access to observe the meeting. In response to the restrictions and guidance in relation to COVID-19, NHS bodies across Wales have adapted to alternative methods of enabling boards and committees to continue to operate with openness and transparency. And I would draw board members' attention to the recently published Audit Wales report, Doing It Differently, Doing It Right, which explores the governance arrangements of NHS bodies during the COVID-19 pandemic and identified virtual meetings as a way of maintaining and, in some respects, enhancing openness and transparency. And as you alluded to earlier, Chair, this is something that we're very keen to continue doing moving forward. So Digital Health and Care Wales will work quickly now to explore how the board and committees can conduct its business in as accessible way as it can do within the current constraints, learning from other NHS bodies who have worked through the pandemic. But specifically on point 2.3, we will be considering the platform to enable live streaming of board meetings and what platform would maximise accessibility to best effect. We're also considering how we best provide translation arrangements so that future board meetings can be held virtually and be simultaneously translated into Welsh and English. And we are looking and exploring how Digital Health and Care Wales can best respond to any access needs sufficiently in advance of virtual board meetings. Board and committee meeting papers and minutes will continue to be made available to the public via our website. So board members are asked to note that board and committee meetings will not be held in public during the current phase of COVID-19 restrictions. This will be kept under close review as guidance changes in relation to COVID-19. Board members are also asked to note the work that we're doing to review how virtual board meetings are as accessible as they can be as we progress, building on the learning from this first live stream board meeting. Thank you, Chair.
Thank you, Chris. Again, I think very clear. I think the important thing to recognise is that, you know, today is very much our first meeting. Our arrangements will evolve over time, you will see, as I say, I think a sort of a different sort of nature to the board meetings as we move forward. In terms of today, though, it was really again just to note that position. Any comments, questions from any board members in relation to the paper from Chris? Or are you content just to note that for today and to recognise that we will come back to the items in there in due course? Okay, that's great. Thank you. At this point, I just need to take a sort of a bit of a take stock in terms of where we're at with our timetable, because we're rattling through our agenda items fairly quickly. You never quite know how long these things are going to take when it's your first meeting, because we were planning to take a break for a quick comfort break between the end of section 4 on the agenda and before we move into section 5, but unless any colleagues are struggling and need to take a break, I'm going to keep moving us through at this stage and propose to move on to the first item, at least of the strategic items, item 5.1, which is on the emergency response command structure, and I'll take another pause at the end of that before I determine whether we just keep moving through the agenda or we do indeed take a short break before the sort of final substantive item on the agenda, which is Helen's paper on the NWIS legacy and opportunities, because I think that is a longer paper. But in terms of taking us forward, I wanted particularly this item to be on the agenda today, because I think it is important that, you know, board members, but also members of the public recognise that Digital Healthcare Wales, Health and Care Wales, has a fundamental role to play in terms of the current emergency response around the COVID pandemic, and it sort of cuts to the statutory duties that we have as a new organisation now as well. So I'm going to hand over to Michelle Sell, our Chief Operating Officer, who has been heavily involved in all of this work over the last months, Michelle, and you're going to present the report to us, Michelle. So can I hand over to you?
Thank you, Chair. Obviously, you've all seen the paper. This paper actually has a slightly different slant than the papers we've reviewed to date, because it does reflect to a degree on our predecessor organisation, as Bob indicated, and some of the practical measures and actions that we took as an organisation in order to support us through the COVID-19 pandemic. So just a couple of summary points I wanted to raise, and then happy obviously to take any questions. So as the paper sets out, in March 2020, you'll all recall, just over a year ago now, as the COVID-19 pandemic was starting to really impact, and in line with guidance from Welsh Government, which has guided all of our activities to date, we invoked our business continuity pandemic plan, which included standing up our emergency command structures. And there were two main drivers really for that, and those have directed all of our activities over the last year. So the first was fundamentally to protect our staff, and in doing so to protect our service continuity really, and the service provision of essential services that we provide across NHS Wales, and to enable us to be able to provide additional support. And we've actually managed that very successfully. Perhaps I should be careful what I say, but our levels of infection within the organisation have been very low. And one of the key reasons for that is because we have been able to enable the majority of our staff to work from home for that entire period. And that is the current working arrangement. The other key driver was to respond to digital requirements from NHS Wales itself, and to be able to provision support and services in response to the work that our colleagues were delivering on the front line. And there's actually an appendix to the report that I included for information of the board, really, which sets out, the many initiatives that we were involved in leading in order to support the delivery of frontline healthcare. So I thought that might be interesting. So just to say that the reason for putting that forward is the current working arrangement. So that's with the majority of our staff working remotely. We are currently planning will run out until the end of June. They are subject to regular review as the pandemic develops. We've got, of our 6 offices, we actually closed 2 of those offices during this time. The other 4 are open and remain open, and that's really because we do have staff who are on site during core office hours to ensure the service continuity, to make sure we can keep the business running. We also have staff who are obviously working on Health Board and Trust and other delivery sites. So we're not entirely working from home, but we've put in place all the measures that you would expect to ensure that our buildings are COVID safe, and that we're providing the right level of protection and support for our staff who are out and about on Health Board sites. So in terms of moving forward, and I think we're all trying to look slightly optimistically forward, aren't we, to the days when perhaps we're less under the pandemic. We've learned a lot during this period, and we've learned actually and had quite positive feedback from our staff generally, that they've enjoyed a bit more of the flexibility, and we've also seen increases in productivity in areas in the organisation that we're looking at in detail. And we want to maintain that flexibility going forward. So we've got a group who've been working across the organisation to think about, okay, what does our future look like? And as part of that, we're looking at how we can use our offices more flexibly and perhaps support a more flexible way of working going forwards. And that kind of remodelling process is already underway in our offices, so that we're able to support that as we move forward. So really it was for the board to note the current working arrangements, and obviously we will provide updates as and when things progress.
Thank you, Michelle. As I say, I think, again, it's a very clear paper, and hopefully board members will find the detail of that and the appendices helpful. I can see that Rowan has a question to ask. Rowan, can I go to you first?
Thank you, Chair, and thank you, Michelle. I just wanted to comment, Michelle, and reflect that really this is bringing some of the best experience of NWIS into the new organisation, which is exactly what we want to see. And also just to amplify really the message that came through in that paper, that the digital agenda isn't just here about delivering better health, but also delivering flexibility in the ways of working, and that is hugely valuable in terms of building a flexible and efficient organisation. So I just wanted to emphasise that, and thank you for the paper. Thank you, Chair.
Thank you, Rowan. Yeah, it's interesting, Rowan, that you reflect on that, and I think it's one of the, for people like me who have been around the system for an awful long time, far too long probably, stepping back in the middle of the sort of pandemic period and playing catch up really in terms of how the world has moved on and how staff are working in very, very different ways and have adapted incredibly quickly to the sort of changes. But as Michelle says, it presents us a whole range of opportunities to do things differently in the future, and hopefully for the better, with all sorts of advantages in terms of staff well-being and reductions in travel and you name it. So I think this is a really important item. You know, the importance for me is you know, it's intrinsically important, but I think for the board is just recognizing that for the foreseeable future, you know, certainly through this probably much of the remainder of this this year, this cycle of our business, our organisation is heavily committed to work on supporting the pandemic response, and that's over and above clearly everything else that needs to be done, that's contained within our plan, and we just need to understand that and be briefed on that from time to time. And obviously, if there's anything more urgent, we will arrange discussions in other fora for board members in relation to elements of that. So Michelle, thank you again. If there are no other questions from board members, I am going to make a sort of a chairman's executive decision, if there's such a thing here, and suggest that we keep moving through the agenda rather than pause at this stage. I can see on my screen that Helen is ready to roll. Unless anybody flags to me in the next about 10 seconds that they're desperate for a comfort break, I think it would just be sensible to work through our agenda, and hopefully it won't run on too long. So I'm not getting any urgent signals from anybody at this stage. So Helen, I'm going to hand over to you. And again, this is something that I was particularly keen to do today. I think a couple of colleagues have already mentioned, and I think I did in my opening remarks as well, that, you know, although we are a brand new organisation today, there is clearly history, there is a legacy, and an important legacy that we are here to build upon from the NHS Wales Informatics Service and NWIS. So I'm going to hand over to Helen, who's going to talk through a little bit of that history for us, but also focus on some of the opportunities for DHCW moving forward. At the end, this is not about any decisions that we need to reach today. This is a little bit of a scene setter, I think, in terms of moving into the next phase of our working. So without further ado, Helen, I'm going to hand over to you, but would encourage colleagues to come back at the end with any comments, observations, questions, things that might inform some of our future discussions as a board. So Helen, I'm going to hand over to you.
Thank you, Bob. So yes, I've you can see from the paper, I've actually my slot is a presentation. So if you can move us on, Taze, to the next slide. So I guess really to reflect on where reflect on NWIS and the last decade or so of NWIS's work and achievements, and also what that means in terms of opportunity and laying the foundations really for Digital Health and Care Wales and the opportunities that we've got going forward. I suppose it's worth reflecting that we've more than doubled in size during that time. So NWIS was established back in 2010 as part of the wider NHS reforms at the time. And yeah, we've gone from 360 staff to 804 staff was the last count we had last week, and we deliver many critical national services. So if you can move us on, Tazy. So I thought it was worth spending a moment just to reflect actually where NWIS came from and when it was established, and what was kind of subsumed under the NWIS umbrella and why really. So NWIS was formed back in 2010, as I said, as a hosted organisation within the Bwrdd NHS Trust. It was formed of 5 different entities at the time. So the first being Informing Healthcare, which was the strategic programme for IT in NHS Wales at the time, which was taking forward the Informing Healthcare digital strategy. The other major entity, if you like, was Health Solutions Wales, which was a IT delivery organisation, so IT and information. So it developed and delivered many systems and services for NHS Wales, and it also provided the national databases and processes for the window into the NHS in terms of national data flows and what is used by Welsh Government for, and more widely the NHS, for decision making. There was also the National Programme for Primary Care, which Claire touched on earlier in her presentation, around the ring-fenced nature of the primary care GP services. Around 14.8 million is ring-fenced for those services within NHS Wales. That was the primary care informatics programme that was then subsumed into NWIS. Along with the business services centres, which were regional centres that were supporting the then 22 local health boards that we had prior to the NHS reforms in 2009, and the IM&T regional services were subsumed into NHS, and the Corporate Health Information Programme, which was set up to improve the quality of the data and the information that we used across health and care. And I guess what you've got there is is the collection of the major kind of strategic and delivery operational services around national IT and information. And the purpose of bringing those together under one umbrella was bringing together the strategic and the delivery under one roof in order to really drive forward the delivery of the digital strategy. So yeah, and in terms of Digital Health and Care Wales, all of those functions, if you like, are still live. They may appear slightly differently, if you like, in terms of the way that we run and our services now, and we haven't got those separations, but the core functions that those organisations were performing actually were subsumed into NWS and continue into DHCW. If I can have the next slide, please. So what I want to reflect on for the next number of minutes, it won't be too long, I promise, is really some of the key achievements of the predecessor organisation to Digital Health and Care Wales. It's not an exhaustive list, it won't be all of them, but actually just bringing out some of the key highlights to try and tell the story, really. So so hopefully this will chime and resonate with colleagues around the table and those who are watching. The digital strategy, and actually if I go back to the informing healthcare strategy, actually, which was in the early noughties, I think 2003, that was published by Welsh Government. The cornerstone of that strategy was the delivery of the single integrated electronic health record. A bit of a mouthful, but actually that patient-centred digital health and care record before we started using the word digital. So it was part of kind of our normal language, but that's what it was about. It was about actually delivering an organisation agnostic view of a person's health and care, and to make sure that we could deliver that wherever that was needed. So the application that that was developed by Informing Healthcare at the time, and now has been actually taken forward and has grown from strength to strength in NWS, is the Welsh Clinical Portal. And that actually is being used now in every health board. It's used by the ambulance service, it's used by the air ambulance service, it's used by primary care to show that window into the secondary care record, but also it gives you the view into the GP summary record. So in Wales, we've got access for all of our residents to the GP summary record in a safe and secure way. So when a patient presents potentially in an emergency environment, the clinician treating them is able to access the GP summary record, and actually importantly as well, all of the documents that we have available electronically, 34 million at the last count and rising. So they are all the discharge summaries. If you've been admitted to hospital and discharged, that summary that goes to your GP will also be available for viewing by other clinicians, and test results. There's heading up to 200 million, pathology and radiology results. And those results are available wherever you present in a safe and secure way. So long as you've got the access and as a clinician to access those results, you can see them regardless of where those tests are undertaken and regardless of where you're presenting as a patient. Clinicians are able to see that. And we've also taken forward the development of the Welsh Clinical Portal mobile app as well, so that clinicians are able to view those results and parts of the record on on the hoof, really, and that's proven really valuable throughout the past year, as you can imagine. So clinicians are able to, on their watch, if they've got a smartwatch, actually view and authorise test results. So if you can move us on, please. And also we've had kind of a long-standing process for electronic transfer of referrals from GPs into hospitals. That's also been enhanced with the ability then to prioritise those referrals electronically. as part of that patient pathway. So you can see that that's, you know, increased in the last 4 years from just over 3,000 a month to over 20,000. And actually the other thing to highlight here is where this is implemented as an end-to-end process, you can eliminate the paper from that process. And by eliminating the paper from that process, you don't have to be tied to a particular setting, a particular building, but also that dramatically speeds up the process. So you go, instead of having days of referral letters being typed and posted and opened in the hospital and then put in the folder for the consultant to review and prioritise, where days, sometimes weeks can go by. Actually, this now all happens within minutes, where that has been implemented as an end-to-end process. So a huge step forward and huge benefits there in terms of the, you know, process savings and efficiency savings. We also have the ability to generate electronic test requests. So for pathology, that's been in place for many of the pathology disciplines and modalities for the last 4 years. That's now being expanded into radiology, and we've got that starting to be rolled out now. It's been live in one health board, and now there's a rollout plan for that. So that means that, again, you're taking a lot of the paper out of the process and speeding up and streamlining the referral pathway and the requesting pathway. But also what you're doing, and this is kind of really pivotal actually, and it's been perhaps brought into really sharp focus in terms of the work that we've had to do to support the response to the pandemic. What the electronic nature of that process does is actually improve the quality of the data. It takes away the difficulties that frontline services have in trying to decipher handwritten, often rushed handwritten requests for tests and referrals into a very structured electronic way, so that they are clearly far clearer. And actually what it also does is ensure that we are able to positively identify the person. So the identifier is really key here, and that's been really important in the way that we have responded to needing to do electronic test requesting in the COVID sampling sites, for example, where, because we put in an electronic test requesting process and we tied it to the patient identifier, we were able then to make sure that those results were fed back into the pathology system, but not just the pathology system that processed them, actually into the digital health and care records. They were viewable as part of that result set. And I feel really proud that we were able to do that, actually, in terms of the way that information then is readily available for all clinicians who need to be able to see that. Some of the other developments that we took forward in response to COVID as part of the digital record were about recognising the almost overnight shift that needed to happen to facilitate remote working, where services were kind of stopped in terms of face-to-face and remote working needed to happen. We developed digital outpatient forms as part of the Welsh clinical portal, so that the record of that consultation, that conversation, whether it was over the telephone or through video conferencing, actually could be recorded as part of the patient record. The other thing that we accelerated during COVID and in response to COVID was the ability to view not just then the test results in the way that I've just described, is actually the images, the radiology images that will also support those radiology reports, so that clinicians could see. They could see the record, they could see the GP record, the documents, the test results, and they can actually see the images wherever they were. And often that was now working remotely from home, or working in the hospital while the patient was at home. So really, really fast tracked. And again, another thing to highlight here is those images. They are the images from wherever, whichever organisation actually undertook those. The scan, the X-ray, whatever the image is, actually that was available regardless of which organisation it was undertaken to, and it was attached to the patient record and immediately viewable and accessible from the patient record. So huge step forwards in the ability, in the delivery of the information and the data that's needed to actually underpin the health and care process. If you can move us on. Other major kind of systems that we support, lots of national systems that we either develop or we support contractually with our third-party suppliers. So lots of close working relationships with our suppliers. We developed the radiology system for Wales and the PACS, the imaging system I've just been describing. So we support that with colleagues through our suppliers. The child health system, and I'll talk a bit more about that in a moment. The patient administration system. So we are behind the majority of the business functions that ensure that patients receive their appointments for a hospital outpatient appointment or an inpatient appointment, and the waiting lists, and manage the case notes within a hospital environment. So we look after and develop the patient administration systems, and the laboratory system as well, which is a single system for NHS Wales that processes 30 million tests processed by the pathology system. But actually, that's increased probably quite significantly over the last year with the volume of COVID testing that is being undertaken as well, that has been processed through the pathology system. The other major area of focus for NWIS and now DHCW is that the information service, and the ability to take the information that is either collected locally and submitted to us as the national agency, if you like, for collecting that data on behalf of NHS Wales and on behalf of Welsh Government, and using that data. So those databases that were developed have been developed over many years. Actually, there's probably over 2 decades, definitely over 2 decades worth of hospital data and other data that is available as part of the national data warehouse, in terms of providing the data and the intelligence. Then, when you've processed that data, join that data with other data that can give you the window into the NHS to understand what is happening, and that's all that has a focus on providing that window up to Welsh Government, and in terms of the reporting that will go into Welsh Government, but importantly as well out to the services. So there'll be data that is collected locally, there'll be data that is collected through the national systems and services I've just been describing, and that is made available to local organisations so that they can use that for local service improvement, patient care, and actually broader service transformations. So data's at the heart of this, really, in terms of what we're trying to achieve. The systems and services and all of the things that I'm talking about are about actually ensuring that the data and the information is there to support the process and the practice of healthcare delivery. And in terms of the other responses to the COVID pandemic, we've been heavily involved. It's probably worth saying that in the Test, Trace and Protect programme and in the Welsh Immunisation programme in supporting those. So I described there a lot of work that went on in terms of being able to request tests, but also in being able to record those tests appropriately. Lots of underpinning system changes in order to make that happen. Lots of work in terms of interfacing with colleagues over the border, in terms of lots of the tests for COVID were undertaken by the Lighthouse Labs. So that data has been flowing into Wales, and it's our system services and the integration engines that underpin our systems and services that have made that available for use. And one of the major kind of achievements, I guess, that was probably it's probably been the quickest development, I suppose, procurement and development of a system that I've certainly seen in my career, where we actually led on the procurement and the implementation of the contact tracing system for NHS Wales and local government. So within around 6 weeks, we purchased configured, deployed and fully implemented a system across 30 organisations, which is all of the local authorities and all of the health organisations were part of that. So a huge endeavour and a hugely positive experience, and one that actually, I think, in all of this space, actually has demonstrated the the benefits of working together as a public service, as one public service in Wales. Actually, I would hold that up as a major achievement, as well as the digital achievements that we managed to make. And then the immunisation system. So it's Nhs developed the immunisation system for NHS Wales for the mass vaccination programme, and that was based on a mature vaccination and immunisation module that was part of our child health system. So we've surfaced that as a web application that allows and supports all of the immunisation centres and the GP practices to record, to offer appointments and to record the COVID-19 immunisations that are taking place. And what that means is that we've got a master record of vaccinations in Wales. We've got one place where we know who has had a vaccine, which vaccine they've had, when they had it, and when they need to be recalled for their next. So you know, a huge, and that again, a matter of weeks actually to get us from almost a standing start into that being deployed at numerous sites across Wales. The other aspects that I'll probably come on to the remote working now on my other slides. So if I move on to the next slide. And some of the broader kind of business work that was done in terms of the, you know, within NWIS, and then accelerated actually in the last years in the rollout of the Office 365 and what we've done to support the websites across NHS Wales. So in terms of Office 365, we had an All Wales contract that was part of actually some of the hidden in some of the numbers that Claire presented earlier was actually the detail of how money moves around the system, if you like, and a big chunk of the money that we get in for from health boards as part of the SLAs actually is to support the national contract for the provision of Office 365. That rollout was accelerated right across Wales, and we've supported that in the last 12 months, and we've seen, and we are experiencing indeed today, the benefit of actually all being able to collaborate in a very I'll say different. Actually, some of these technologies were already there, and we could already have been using them perhaps better than we were as a collective, but actually they've improved significantly. I think we can all reflect on our engagement with them out of necessity, clearly, but you know, has really stepped up, and it's allowed us to keep working actually, and to in some areas improve the ways of working in keeping communication and collaboration moving as part of the health and care service. As I said, we provide a number of the websites for NHS Wales and the NHS Wales website, and we were supporting all of the organisations in the new systems that we've got in place to manage the content of those websites. But it's really good that gives a one identity for all of the NHS Wales websites, so that you know that actually it's an NHS Wales organisation that actually you're engaging with online. But of course, all of those things actually won't work and won't deliver if we don't do the stuff that's actually under the bonnet. So we've got the extant strategy, and the previous strategy for NHS Wales is an architectural approach. It's not one monolithic system and service that provides all of these functions across NHS Wales. It is a platform approach. It is an architectural model that's standards based, so that the data can move around the system where it needs to be, and in the safe and secure way that we're exchanging information across systems and services through the messaging fabric and through the national architecture, which means that data recorded about you by a clinician in a hospital is then shared with other areas across NHS Wales and vice versa. And there's a lot of work that a real focus for the new organisation actually for DHCW is actually how we step up as part of the National Data Resource Programme, one of our flagship programmes that we'll talk about when we get into the plan in future discussions. Actually, we step that up into an open architectural model and really embrace new standards and support that with a full standards framework. And of course, the really hidden stuff is the stuff that we only hear about if it goes wrong, and that's our data centres and the provision of our networks and our services and our servers and all of the work in the infrastructure area. So we commissioned 2 data centres on behalf of NHS Wales, and that again is one of the major programmes of work for us this year, actually leading us through the summer and through to early autumn in terms of migrating from one data centre to the next. But these are the things that actually keep these systems and services up and running and ensure that we have that data and information and those functions, and all of that data is flowing around the system. Next slide, please. And I touched on this earlier in terms of the Welsh GP summary record, but I make no apologies for drawing this one out again. I think probably Rydyn, who's our medical director, would say it's one of the things he's most proud of, actually, is in his achievements as the medical director for the previous organisation, of course now for DHCW, is that we have access to the GP summary record within the Welsh Clinical Portal, and that is available wherever a patient presents. So in the absence of any paper, in the absence of the patient being able to be the record, which often is the case in a healthcare environment, clinicians are able, doctors, nurses, and those with access are able to access the summary of the GP record, which will give you a view of, your diagnoses that are recorded in that GP system, and any major interventions you've had, and importantly what medication you were on there. So a huge, actually a huge benefit in terms of being able to see that view of the records. And you can see it's gone from virtually nothing in 2015 to 42,000 being viewed in the 6 months of 2020, in the final 6 months of 2020. So it's being used day in, day out in the NHS to actually support health and care decision making. And another area in terms of the primary care service provision is again, it's one I think that is a bit of a quiet hero here, which is the Choose Pharmacy system, which is a system that was developed by NHS to support community pharmacies actually enhancing their services to provide more services to patients, to alleviate the pressure on GPs and to really operate at the top of their licence. So things like the common ailment service, the system that supports the provision of that service is the Choose Pharmacy system, and it has a number of modules. One of those, the sore throat test and treat, so that instead of going to your GP if you've got a sore throat, your local pharmacist can actually swab you in a consultation and tell you whether you need antibiotics or not, and which is really helping with antimicrobial stewardship as well. So a huge, a huge thing to be really proud of, actually, in NWIS and now in DHCW, and actually part of the primary care kind of basket, really, of systems and services that we provide. And then we also support and manage the contracts for the GP systems suppliers, but and more than that, we provide systems and services that have really kind of stepped up. We've seen a big change, actually. I think a step change in the way that primary care services are able to run, and a lot of that has been accelerated over the last year due to the response to the pandemic. So being able to work remotely and support the video consultation service, the full rollout of that in primary care, actually make electronic test requests and to see results, whether they're hospital initiated or GP initiated results, to transfer data from one GP system to another if you move practices, and also to actually enable GP practices to support each other, which has been particularly important during the last 12 months as they work in their clusters and their hubs. We've been able to give GPs access to each other's systems to work in kind of a buddy fashion, and to give them access to their practice systems when they're at home. so that they can use and access the clinical systems, but not needing to be on the premises. So some huge step forward in the provision of services out to the broader kind of primary care, along with probably worth mentioning the dental e-referral system that is there, that actually enables electronic referrals in from dental practices now into secondary care. And also going forward this year, there'll be support for optometrists in terms of the different service models that are being developed and implemented, actually, to engage and take on more of the optometry workload from secondary care. So you can move us on. And I guess the other stuff that's even more hidden often is the stuff the stuff that keeps us safe and keeps the data and systems and services safe and secure. And we are, you know, custodians of health data and health systems on behalf of NHS Wales. So we play a lead role in the information governance agenda for the wider systems and services, and we'll. That role will be enhanced in the new organisations as we develop the information governance framework that we need to ensure that we've got all of the checks and balances that we need to assure that data and information is used appropriately and is safe and secure. We also have strong clinical assurance processes that are testing whether the developments, the systems and the services that we are taking forward are safe in terms of the clinical context of their use. So we operate industry standard approaches to our assurance processes and our clinical risk management. And importantly, then the cyber security, we've grown, as you would have expected, actually, in these current times. We've grown our cyber security offering for our organisation and how that supports more widely, given our role in as a national kind of deliverer of services. So we've got real importance placed on the on cyber and our ability to ensure that all of our services and our networks and our systems are as secure as they can be. That's a constant challenge, though. I think that as a board, that's an area that we would want to focus on. I think, as we move through kind of the early months of us forming as a board, actually to understand all of the key risks that there are out there and what we're doing to mitigate those risks and what else we could be doing in that space. One of the things that we will be doing in that space is as a separate entity, we will be delivering the cyber resilience, as of today, actually, the new cyber resilience unit on behalf of Welsh Government, who are the competent authority under the National Information Systems Directive and regulations to actually provide they need assurance from operators of essential services, and we are one. As are all of the health boards and trusts, that the cyber security and the cyber posture, which is the term actually, and our cyber resilience are of the standard that we need them to be to ensure that we are keeping things as safe and secure as they can possibly be. Let's move on to the next slide. And of course, all of that is only possible because I think I spoke this morning at the staff briefing, and we talk about the organisation. The organisation is about people, isn't it? You know, and the organisation is the people. It's the people that work for us. It's us as the board. It's also our partners, because we're a partner. We're a member of the NHS Wales family, and we are a partner in that. And we've been very mindful of the need to make sure that we are developing the talent of the future, our talent pipeline, the cadre of digital professionals of the future. So back in 2017, we signed a partnership agreement with Trinity St David University. And more recently, the University of South Wales have also joined us in that partnership, where we're really looking to invest in the training and development of the people of Wales actually who are interested in actually embracing a really exciting career opportunity and developing their skills in digital health and care. So we focused initially on some of the areas where we were having difficulty in recruiting actually, and let's not forget that we're in a highly competitive marketplace in terms of digital skills and our ability to recruit. And often in the NHS, that's quite a challenge for us, really, in terms of the way that we could be compared to the private sector. There are many benefits to working in the NHS, but we felt that we needed to up our game, really, if you like, in our ability to recruit into some of those hard to recruit areas, like software development, like cyber, actually, and like data analytics and data science. So we developed degree courses as part of the Wales Institute for Digital Information, which allowed people to undertake their degree whilst they were living and working within Wales. So that's attracted new students coming through, you know, to do that as their first degree. It's also attracted mature students and some of our staff and the wider NHS Wales staff to actually undertake these degree opportunities and apprenticeship opportunities. So that's going from strength to strength. And I think, again, another key area of focus for the new organisation moving forward, and how we really take that forward, that kind of professional development of our workforce agenda, and also how that supports our research and development agenda going forward. And that we've also, and Rydian personally has done a lot of work in terms of the development of the clinical informatics agenda, and how we are taking that forward in the CCIO network, and supporting actually a number of clinicians to actually go through the digital academy process and get their formal kind of qualification in terms of growing, again, a cadre of clinical informaticists and clinical information leaders to actually take this forward. And another area really that we shouldn't lose sight of is the systems and services, and even the data. Actually, they're only of use if they're being used, aren't they? You know, and that really is part of the business change and a focus on business change. The benefits are only realised when all of these things are used and they're providing improvement or transformation out there that actually is delivering benefit. So actually a focus on business change has been that's been a real focus in NWIS in recent years, and actually we are working with our partner organisations across NHS Wales to grow that kind of change network, if you like, to ensure that we kind of sustain and embed change in the way that we can, and a lot of resources and materials to actually get the best out of our systems and services. Can you move us on, please? So I guess that was the achievements, but actually they've been recognised in the last year with 3 awards, and the 2 here are the Nursing Times Awards. This was for the nursing, the Welsh Nursing Care Record project. A huge kind of step forward, this, and it's been led really passionately, actually, and expertly by senior nurse leaders from within our organisation, actually from the local organisations, to demonstrate that kind of nurse leadership that you need in the informatics space. So this isn't simply about taking the paper away from the nursing process and replacing it with an electronic one. This was about standardisation and the approach from ward through to Welsh Government, actually, in terms of having standards in place, standard process, standard data, standard definitions, but also it's developed a leadership capability in chief nursing information officers to actually really kind of drive forward the digital, the informatics agenda for the nursing workforce, which are our, you know, our biggest workforce, our biggest staff group in NHS Wales. Super proud of the guys who won that award and they were recognised in the technology and data in nursing category at this year's awards. We also won an award from Medi Wales for the WCP mobile app, which I touched on earlier. So that's great, really, in terms of, you know, acknowledging but also demonstrating how we can quickly step up technologies that are really going to impact in the way that we kind of expect to work now, that we are really kind of trying to engender within health and care process. So if you move us on, please. And I guess the big award that we won in terms of UK IT industry awards, this is the British Computer Society Award. This is all all industries. So it's not just health, and it's all IT industries. And we were awarded the best place to work in IT, I think, as a pinnacle to the end of NWIS. I think you probably couldn't ask for a better one. So we are tremendously proud, actually, and it's not when I say we, that's the organisation, and I suppose myself and the leadership team are. We are tremendously proud of the commitment and what we've seen our staff actually do and deliver over this last 12 months, but actually over this last kind of decade or more of NWIS, but particularly brought into sharp focus in the way we personally have all been dealing with the consequences of the pandemic, and as an organisation, we've really kind of hopefully demonstrated how we've been able to step up and absolutely support the frontline services. So yeah, very, very proud of that in terms of an accolade at the end of NWIS. We can move us on. So what that does is actually create, I think, a really strong foundation, a really strong base from which we can really move forward. So we're not done, are we? Some of this stuff is just beginning. So with Digital Health and Care Wales, it gives us the absolute opportunity and platform now to work with our partners to actually drive the transformation agenda forward. And I think it was Rowan, one of our new independent members, who mentioned earlier when we were speaking that actually we'll know we've achieved digital transformation when we stop using the word digital, because actually it's about transformation and it's about taking that forward. So it's a real opportunity for us really to drive forward in Digital Health and Care Wales. You can move us on, Daisy. And for us, that's about moving forward as a trusted partner, as part of the NHS Wales family, and about working together to actually have joint strategic planning in place with all of the other organisations across Wales, translating the digital strategy into the strategic roadmaps for delivery, and really kind of moving that forward together, actually, and restating those relationships and those networks that we need to actually succeed. Can move us on, Daisy. So really my final slide is I just wanted to leave this one with you really, and to share with you. In our last NWIS staff briefing we had a week or so ago, I asked the staff, what 3 words sum up NWIS for you? And actually, I think this is really lovely. That it's, yes, it says technology, and it says about, we're a professional, digitalization, but it talks a lot about collaboration and support and family and teamwork and togetherness. And actually, I think that tells you something about actually the culture and how it feels, actually, because that was the question. What does NWIS mean to you? So I think actually this actually brings that through kind of really loud and clear, that it means a lot that we actually, when we're a digital organisation for and in the NHS, and that caring and compassionate kind of way that we approach our work actually shines through, I would hope, in all that we do. There's more that we want to do. We want to grow, we want to change, we want to adapt. And I think that the opportunities now that we've got actually as we step into Digital Health and Care Wales will only see us grow from strength to strength. So thank you. You're on mute, Bob. Sorry.
I promised myself I wasn't going to do that at all in the board meeting, having managed it a couple of times this morning. But I was so intent on listening to what you were doing, Helen. I didn't want any noise in the background to get in the way. So my apologies. Look, that was fantastic. Thank you. I think that's really important. At this moment, today is a day of celebration. I think in a number of ways, it's a day of celebration of what's gone before. And I think you've just taken us through that in a very, very effective way. And it's a day of celebration about the new as well, in terms of how we move forward from here. There is so much in there. There's so much packed into that presentation, Helen, that I can see already. I've got a number of board colleagues who want to come in with questions or comments. So I'm going to go straight over. I'm going to keep us going. I'll see how long this goes for in terms of discussion, but I'm not proposing that we break now. I think we may as well work our way through our agenda, unless anybody sends me an urgent message that they desperately need a break for the next 10 minutes. I'll take us through. So just looking at who I can see flagging up. I think Marion, I think you were first. I think you did make a comment in the chat bar about the Welsh patient referral system. You might want to come back to. I think you might have another question as well. So can I ask you to raise your points?
Thank you, and thank you very much, Helen, for that very comprehensive presentation, and really heartening to hear about the achievements, especially those awards that you've outlined in the last few months, and I think the organisation can be rightly proud of what you've achieved. Having said that, though, there are clearly some concerns out there. There have been criticisms as well, which have been well rehearsed at the Public Accounts Committee with Wales Audit Office as well. And I just wondered, in terms of rebuilding the relationships going forward now, this brand new organisation with some of those health boards across Wales, what are your priorities, what you see as your priorities going forward? Perhaps crucially, where you think the biggest challenges lie in terms of rebuilding those relationships.
Thank you, Marianne. Yes, so I think that we've begun that work. So we recognised it. We recognised that the relationships did need to be rebuilt in some areas, and what we've tried to do is to start a strategic engagement programme. But actually, that's sitting across the table from our colleagues in the local organisations. So that's the informatics teams, the digital teams, but also the executive teams as well, and often the chief executives, to actually really understand where we're coming from in terms of our strategy and our priorities, and also how we then kind of agree. So part one of my slides was about kind of that trusted partner and working in that way, but actually agreeing a joint plan. That's, you know, that's what we the intention is. We've got a way to go in terms of maturing into that process, I think, and there's always more to do for us and the local organisations than we are able to do, given that, you know, and we'll come back to Claire's kind of presentation earlier in terms of the financial envelope, but as often as well, it's not just the money that can be a constraint in this, it's the expertise that we need, it's the people and the demands that we've got on them. So growing the people and working in partnership. So that's not just about recruiting, that's also about working in partnership with, you know, industry partners to upscale, so that we have the opportunity to respond in that way. But I think that the more conversations, open and transparent conversations, more engagement. I think that that's, you know, incumbent on us as the board actually to engage more widely with the boards of the local organisations to really kind of set those joint planning expectations and agree them, so that we all understand what's expected of us. So it'll take a bit of time, I think, Marianne, to be honest, but I feel, and the feedback that we're getting is that we're on the right track on that.
Thank you, Helen. Marion, did you want to come back at all on that?
No, I think that's really heartening to hear, and as you say, it's incumbent on us all, isn't it, to join you in this challenge and the journey ahead. I think my other question has been clarified. Thank you already. Thank you.
Okay, thanks, Marion. I think I would just add as well. I think, you know, one of the opportunities that we clearly have now in terms of being established as the new organisation is that, you know, people within it, myself as chair, Helen as CEO, but other executive directors, our vice chair Ruth, we will all become part of those wider networks that function across the NHS in Wales, in which the kind of day-to-day discussions happen. We weren't party to those before. I think it's possible then, you know, you can nip problems in the bud when you're meeting people, but something we have talked about, and I'll want to come back to this with the board, is about how we plan for over the next year sort of board to board engagement, with others, because you're right, Marion, you can't shy away from issues and difficulties that need to be resolved. We understand that, and you know, it's always a challenge dealing with those issues whilst you're also trying to take forward the sort of agenda that Helen has outlined today. But you know, I think that's one of the big commitments coming from today, really, that this is about doing business differently, and that trusted partner thing that Helen referred to, I think, is really important. That's what we've got to work towards, and what we've got to build on. I'm going to go to Sian next. I can see Sian's camera's on. So, Sian.
Diolch Bob, a diolch Helen, adroddiad hynod o cynhwysfawr, a lot o bethau i fynd ynddo fe. I loved the report. It was great for us as a new board member just to understand just the size of the legacy, but also what a great foundation that has already been built. Couple of comments from me, one building from Marion and what Bob has just said around collaboration is getting real counsel over the next few weeks on how do we safeguard that we have true involvement of the stakeholders, you know, and a real good two-way feedback, whether that is the clinicians, the patients in the field, or, you know, the GPs. Be really good to get your guidance and make sure that we are clear on that. So good to hear from that and what you've learned over the last couple of years or 3 or 4 years from that. And then the second thing for me, I think, is just building on your report. It'd be really good to understand how we track the benefits. Not always is it about money or efficiency. Sometimes it's about wider engagement. Sometimes it's about ease of use. Just to get a real understanding from you about what are the key benefits that are tracked. Do you know what I mean? So that you actually know that you're successful as you build some of these programs, because it's very easy to think about it. It's another one to track it as you go through. So a couple of comments from me and perhaps your thoughts on that. Thank you.
Thank you, Sian. Yeah, so the first bit of the question there around kind of the involvement of the end user. So from the way that we're organised, in terms of the support of our projects and our programs as they're kind of established, and then our services as they become live. Actually, our arrangements, our governance arrangements for those services are actually very service-led. So they're part of the decision making. They're part of, you know, setting the direction. I think that actually there's more that we can do in that space, actually, to ensure that we're doing the right things in the right order as a collective, and that we've got that in place. But the structures are there. I think that we need to make sure that we've got they're being used in the right way, and that we're all, you know, engaged with them in the right way, and that's the broader kind of NHS family, I think. But and I think in terms of that, that's also though to test them that we're getting all of the voices heard around that table. That's what I mean by that. Actually, I think we've got a process, but have we got the right voices coming through, and then therefore the right priorities that are being taken forward. In terms of patients, we've a lot of our developments to date have been kind of clinician facing, so health service and system facing. But actually, as we step into the new organisation, it coincides with the launch of a new programme of work to look at the digital services for patients and the public. So we really have a focus there on the systems and services that are patient facing and citizen facing. So how we engage with them is part of that, you know, really an absolute pivotal important part of that programme of work, and more broadly how that impacts what we do as an organisation then as well. There's also a new centre for digital services for the public been set up by Welsh Government as well, so we're engaging quite closely with them in terms of kind of user-centred design initiatives, and particularly in the space of developing things for the patient, because the worst thing that we could do, I guess, is to assume that we know what the patient wants because we know what the service needs. So I think, and I mean more broadly, not just us as an organisation, more broadly as a service. So we need to ensure that we've got strong patient voice in all of this, actually, to drive those priorities and those services forward. But they go kind of hand in glove, because often what we need to support better systems and digital services and interactions and accessibility for patients has to go hand in glove with quite often major service changes out there to make that work in practice in the health service. So it's that change programme that needs to go hand in glove with it. So that's what I'd say in terms of the involvement. And in terms of tracking benefits, so each of our projects and programmes actually will be built on a business case, a proposal that actually describes what the outcome is going to be. Why do you want to do it? What's the so what of the investments and that are going to be made? So those benefits are there. I would suggest that we're probably not as good at tracking the benefits as we perhaps would want to be. I think that's as a collective, and I think that's part of one of the major areas of focus for us as we work in partnership with the delivery organisations, where the benefits are actually being the opportunity for those benefits is actually out in the delivery organisation. So how do we work together within the new governance structures to ensure that we've got tracking of those benefits? And I think that's a real focus for the new organisation in supporting and facilitating that with the wider NHS. So we have lots of benefits that have been developed. I mentioned some of them. I know there were lots of metrics rather than benefits metrics in the in the examples that I've given, but we do have some of those. But actually, I think there's a lot more that we need to do in that space to demonstrate what the opportunities are and the benefits that we're delivering.
Okay. Thank you, Helen. Sean, is that okay in terms of response today? I mean, I think both issues that you've raised, things clearly we will come back to in our future deliberations, because they're really important issues.
Definitely, thank you, and good comprehensive answer. Thanks, Helen.
Thank you, Sean. Grace, I think camera's on you. I think next question, please, or comment. I think you're on mute, Grace.
Thank you, apologies for that. Thank you, Chair. Just a comment from me. So fantastic, really appreciate the presentation, and there's so much to build on and towards there. And what I'm aware of as I was listening to some of this is that a lot of existing health infrastructure was in part designed to get the clinician, the notes and the patient together in the same place at the same time so that treatment could move forward, and I know here that we're moving to a new frontier, you know, far beyond that, but I'm still aware we need to be mindful of the digital disenfranchisement that we see across Wales, the considerations about the internet being another utility and being part of our actual infrastructure to be able to really access essential services, and in digital health and in care as we move forward. So I just wanted to note that. Thank you.
Thank you. Thank you, Grace. Helen, do you want to just comment on it? I mean, I'll probably comment on it as well, but do you want to go first?
Yes, please. Thank you. Thank you, Bob. Yeah, Grace, I couldn't agree more, actually. And one of the areas that I think that we'd like to focus on early as a board that we'd suggest is that we sign up to the Digital Inclusion Charter as an organisation, and that we work through what our responsibility and our opportunity is to actually bridge some of the inequity that we see, and actually what's our role, what can our role be actually in actually supporting and reducing the inequalities that we see in terms of digital exclusion, and also how we work with services to ensure that actually the breadth of services are able to be delivered and developed and nobody is left behind, really. And I think that as an organisation that's a quite an exciting area for us to work in, actually, and I think exciting as well for all of our staff to get engaged with. That's something we'll do as a board, but it's not something it's just us that will do that. It's for our staff as well to really get engaged in that digital inclusion agenda. So yeah, I think that's a really exciting prospect for us.
Thank you. Thank you, Helen. And Grace, I'd just add a couple of things. I think, you know, we talked earlier in the day and with Andrew Goodall when he joined us about the overarching ambitions for our system in Wales around a healthier Wales. And clearly right at the heart of that is about our ability to reduce inequalities. The last thing we want to do is to take forward work which exacerbates inequality or creates new inequities in the system. And I think, you know, we had a discussion at the Chairs Network, and I know chief execs have as well recently, thinking ahead to the sort of the post-election period and the recovery period and the things that need to be done. And I think this issue around digital inclusion is really high on everybody's agenda. And as Helen said, you know, we flagged that we want to play our part in that moving forward. The other thing, I'm reflecting back actually on the sort of process we went through for appointing independent members, and I think in a lot of those conversations, this was something that we picked up, and I know that we've got quite a lot of expertise in you as a group around this as well that we need to draw on from other sectors where, you know, this is not something which is unique to health and care, is it? You know, but certainly, you know, we can't move forward in, you know, around this kind of digital first idea if that leaves, you know, 20-30% of the population behind. That is unacceptable. So we have to find the right strategies moving forward. So thank you for raising that. It's a really important issue. I think I've got a couple more I can see there. Ridian, your camera's on you. So do you want to take your question or comment?
Thanks, Bob. I just wanted to expand on some of the benefits that have been shown on the slides, and perhaps touch on a few things that maybe board members and our listeners wouldn't be aware of. But first of all, we've got 27,000 users across NHS Wales using the single sign-on platform. 1 in 10 results, pathology results, on patients when they visit a health board come from not that health board. In other words, they originate from a different health board as the patient goes along their journey. We're actually over 1.8 million tests have been viewed outside the health board that they originated in. If you actually collate that means previously what clinicians like myself would have done is potentially rebleed the patient because we didn't have access to the results, or weren't able to discuss the results in the consultation at the time, therefore delaying getting the resolution of the patient's problems. Or our secretaries would then be ringing a different hospital, trying to get through and disrupting the workflow in the hospital where those results came from. It's worth noting that the Welsh Patient Referral Service has taken on the studies that we've done has taken 10 days off stage 1. 10 days, that's paper in the system. Also, massive benefit, of course, that record is visible in its journey. We know where it is, whereas pieces of paper move in folders and get lost. The whole process is auditable, which is another great thing. Then we look at what Wales has delivered in terms of image sharing and mobility. We only need to go back five years, and the situation was when you moved to a different health board, your imaging would have been sent on a hard CD. It would have been loaded up. It would have been labelled incorrectly because each service had a different way of labelling things. Now we have the ability to move images through essentially 2 clicks from the bottom of the report. This is facilitated cancer pathways, MDTs, and very importantly, the emergency services of transport of patients to regional services. So you can think of neurosurgical services, and you can think of spinal services. And then finally, and Helen would probably know that I want to say this, our partnership with our primary care colleagues and the delivery of the Welsh GP summary record for every citizen in Wales is something that has not been done anywhere else in the world. It allows us as an organisation to see the longitudinal record of patients who present into acute services, to the point that we know that the Welsh Service Hub can see the record. We even know that the EMIRTS, the air ambulance team, can view the record in an iPad in the sky. These are things that we don't shout about in Wales, but are fantastic foundations for the new organisation going forward. The pharmacy reconciliation in hospitals, it used to be that pharmacists would have to ring the GP surgery and they would have to use a safe fax process to get the patient's pharmacy results. on average, we've saved 17 minutes per medicines reconciliation for hospital pharmacists. You know, that is as a real saving, and more importantly, a patient benefit in terms of safety. And then because we've built that record, we can signpost patients to different services in our communities, reducing demand on the acute services, and therefore patients get an equal or better quality service from places which are closer to their home. So I think it's a really exciting position to be in as we move forward into this new era.
Thank you. Am I on live? Yeah. Thank you, Ridian. I mean, I think some of the lovely examples there, sort of bringing to life some of the things that we're talking about. You know, obviously building on your personal experience in the field as a practicing clinician, as well as those kind of wider system benefits. So that's really helpful. Thank you for that. I've got one more question being flagged, which is Rowan. So Rowan, I'll come to you. If anybody else does want to come in, please indicate to me, because if not, I will start to draw matters to a conclusion after Rowan's question. So Rowan, over to you.
Thank you, Bob, and Helen, thank you. That was a fantastic presentation. It was very comprehensive. I heard all sorts of pieces in there that spoke to best practice in terms of data being findable, accessible, interoperable, and repurposable, all of the FAIR principles, which was great. I think I would note, and Marion said it very well, that perception and reality are often different, can be different things. And from my experience in the private sector, whenever we were talking about any health-related innovation, the bit that would all make us sort of, inward breath is any change in clinical practice. Change in clinical practice, whether you're on the outside or the inside, is really hard to do. And I think, we should. I just want to give you some reassurance that the board recognises that, and there's clearly work to be done externally in building these partnerships between the new organisation and the other 11 partner organisations that make up NHS Wales, in order that the human part of the race, because it's not just building the technology, it's educating potential users to the benefits. And Ridian, that was a perfect summary of why we need to be in this to win it all day long. Of course, I wanted just to sort of also ask that we maybe give some thought internally to what we can do to build a dashboard that can be an early warning system of where things are not landing effectively with our customers. So, that number you presented, 42,000 views per month of the Welsh GP summary in the last couple of months. I would love to know, given all clinicians in Wales having access to that capability, how many views might we expect? I think Ridian may be able to give us some guidance, so we can track sort of penetration and start to think in those ways, because across all of your catalogue of services, that will help us prioritise some of the conversations. And then finally, you did quote me on what success would feel like to me, digital health just being referred to as health. I think there's one other piece really, which is to recognise the wider scope that this organisation has from Welsh Government around digital health as it relates to the people of Wales, as well as the clinical services. And for me, success will be measured when those wonderful people I heard on that video this morning are talking in the primary care GP support services, that they have GPs ringing them saying, I've got all of these patients coming into my surgery asking me, do I have my Welsh GP summary in front of me during my consult? So that patient pester power and really engaging with our wider stakeholder group, I think, can be very powerful for us. And thank you, Helen. That was a great presentation.
Great. Thank you. There we go. Thank you, Rowan. I think some really important issues that you raise again. I don't know, Helen, do you want to comment on anything that Rowan said before I do?
No, just agreeing really in terms of that how we kind of harness the broader kind of patient power, actually patient pester power. I quite like that. And actually we've probably all been that patient or relative pestering a clinician to say, surely you can see the medication record. But so I think that's it's a really good point. And I think there are great opportunities for us to do that going forward.
Yeah, that's great. Thank you. And I think Rowan, you've given us a couple of things today in terms of, I think I'll remember pester power as well. And as I'm seeing Helen on camera, I can see Digital Health and Care Wales, the logo up behind the side of her head. And I'm waiting for digital to fall off there now at some point, given what you said earlier. So I think specifically the issue you raised, Rowan, in relation to dashboards, early warning. Yeah, absolutely. We need to sit down and talk about that. We have to. As I say, today it's about celebrating really good things which have been done, and it's a glimpse into the future as well in terms of where we're going at. But being self-critical, that's something that's really important for us, I think, as a board, isn't it? As we move forward, we're the first group of people to ask ourselves challenging questions about whether we're delivering what we need to deliver and how that is going. So that is something that we do need to build into our ways of working. Sorry, Helen, were you trying to flag? Yeah, just want to come back.
Yeah, sorry, just picking up on the dashboard question actually, or observation actually, and recommendation from Rowan. So yeah, we've got some work around digital maturity, I think is the way that we've looked at this previously, not just us as an organisation, but more collectively with the other delivery organisations. So I think that we'd actually had a conversation as a leadership team about actually what does that look like for the new organisation, and how do we start to kind of surface that level of detail really in terms of adoption of systems and services, and what that means in terms of benefits, speaking to Sian's point. So I think that actually that could be something that we focus on as a board in terms of kind of, designing that, if you like, and taking what we've got and actually improving that to provide that visibility, if you like, and that window into what's going on in terms of adoption and benefit.
Great. Thank you, Helen. Look, I haven't got any more questions coming through to me, but I think that's been a good discussion as a start in terms of reacting and reflecting on Helen's presentation. So it's really, I think, now for me to sort of draw this first meeting to a close. I haven't been informed of any other items of urgent business, so I'm working on the assumption that we don't have any. Looking back across our agenda today, I think, as I said at the outset, this is very much a first starting up meeting for us as Health and Care Wales. So I'm pleased that we've been able to agree that the kind of the ground rules through our standing orders and SFIs, policies, etc., financial framework for the immediate future that enable us now to move on and move forward. As I say, I think, quite rightly today, I wanted to acknowledge what's gone before. I do think it's really important to acknowledge what's gone before. We're not starting here from from scratch. But the momentum is with us, I think, in terms of building with the new organisation, working with our partners. I think, I get a sense of a common sense of sort of urgency and ambition around the table in terms of what we're here to do and what we can achieve. So I just wanted to draw the meeting to a close. Just a couple of thanks. Perhaps I should have done this at the beginning of the meeting, but just to round us off, because I did want to. I mean, I think we've done it already, really, in terms of acknowledging and thanking colleagues, past and present, from Nhs, from previous leaders, Andrew Griffiths and others of the team, and in terms of what we've just been reflecting on now. I also did want to acknowledge colleagues in Welsh Government In our earlier sessions today, Andrew Goodall did join us. Andrew Goodall, the Director General in Welsh Government, did join us. But Andrew himself has put a great deal of effort into this, along with many of his colleagues who've been both supportive of NWID, supportive of the direction of travel to develop digital health and care Wales, and actually helping through the enormous amount of practical work that's been necessary to get us today, including the legislation going through government and well, too many other things to touch on today. So it's a big thank you to colleagues there. For me, particularly to Helen and the wider team and everybody who's been around supporting us today to get through this first meeting. Hopefully, I'm not quite finished without any sort of major technical glitches, which is always encouraging. But it's certainly been very easy for me as chair today to sort of take us through this. And I also just wanted to thank Velindre Trust as well. I said in the staff meeting this morning, Helen and I had a lovely letter from Donna Mead, the chair of Velindre, and Steve Ham, the chief executive of Velindre, wishing everybody well, and to acknowledge Velindre's role as a trust as being the host of NWIS over the last 11 years, but also in terms of working with us on the smooth transition of services and staff across into the new organisation. So I just wanted to finish with those few words of thanks. And there's nothing really, I don't think, any more for me to say than to note that the date of the next meeting, formal public meeting, is in the morning. It's 10 a.m. On Thursday, the 27th of May. We've had a decent number of people watching in from the outside today, so I hope you spread the word and join us again in a couple of months' time, and hopefully more people will join us as well. So really, from my point of view, it's just an opportunity to say diolch yn fawr, thank you. Wish everybody a good weekend and a happy Easter, and look forward to meeting up with board colleagues shortly and others who've joined in our meeting today at future meetings. So diolch yn fawr, thank you very much. Have a good weekend.